Hi, my name's Hailee Brown. I'm a student nurse at South Alabama, and here's my badge. I just want to go ahead and apologize to you in advance for my room. It's really nasty and dirty. But here's my room. And yes, it's my video for medication administration. So what I'm going to do first, I'm going to talk to you about stuff I'll do before I even decide to, do any type of medication administration. I'm going to just make sure that I don't have any limit my conversations, make sure that I have no phone calls, and that I'm limiting my distractions at all, and my door's closed to my room, making sure no one's going to be able to come in here, and I'm following the no distraction, no disruption policy for hospital. And so next what I'm going to do is I'm going to go ahead and get my order forms and my medication forms. I'm going to go ahead and I'm going to compare those. I'm going to perform hand hygiene before that. But now I'm going to just go and compare. So we have Jaguar J. Jones, date of birth 8/25/1963, 8/75/1963, medical record number 4176352, medical record number 4176352. And then we're gonna do the medication that we're gonna do today, which is morphine sulfate. Then we have the dose, which is 5 milligrams, 5 milligrams. The route, intramuscular. Time, every 4 hours. And then we have the indication, which is as needed for pain. And then that's basically what we're gonna do. So I'm gonna set my orders to the side, make sure you make the order. And now I'm going to go ahead and I'm going to perform. Where's my tape at? Where'd my tape go? Yep, sorry. Now I'm going to perform the first rites for the 7 rites. So when I'm going to do the rite, patient, which is Jaguar J. Jones. Then we're going to do the date of birth, 8/25/1963. And then we have the medical record number 4176352. Then we're going to do right medication, which is morphine sulfate. I do have morphine sulfate out here. This is my vial. And then we're going to go ahead and do the right route. And so I have intramuscular, so I'm going to use a 3 milliliter syringe, and I'm going to use a blunt cannula, and I'm going to use a 23 needle. And so next what I'm going to do is I'm going to go ahead and do the right dose. So what I'm going to do is I'm going to just go ahead and calculate that. So since I need 5 milligrams and this is a 10 milligram thing, I do want to check the expiration date just in case. Right now it's a 12/20/2025. We do want to make sure that we calculate that to a half syringe. So I'm going to make sure I get a nurse to check that as well with me. So next what I'm going to do is I'm going to go ahead and perform the right dose with my syringe. So I'm going to go ahead and get out my 3 milliliter syringe, and I'm going to put my blunt cannula on, and I'm going to make sure I don't really touch it just for sanitary or sterility reasons. And so next what I'm going to do is I'm going to go ahead and wipe my vial down with alcohol swab just to sterilize, make sure it's sterile, throw that away. And so next what I'm going to do is I'm going to just use my package just to open up the blunt tip, and then we're going to use this for to put it in. So what I'm going to do is I'm going to just go ahead and put the air in for a half syringe. So I do have it the half. And so now I'm going to just inject it in, and I'm going to pull back, and we're going to make sure there's no air bubbles. So I'm pulling it to my half. So I want to show you, this is my half right here. And so with that, I'm going to go ahead and I'm going to put my blunt cannula back on, and then I'm going to go ahead and try to put on my blunt needle. And with that, I'm going to take off the blunt, and I'm going to throw that away in the waste container. And then I'm going to put on the 23 needle. And so with that, I'm going to do the sweep method. So I'm going to just open the package a bit more, and I'm going to go ahead and sweep it on. It's kind of a struggle, I don't know why it is. Okay, and so I have it on, and now I'm going to just go ahead and set this to the side, and I'm going to do the rest. So we have the right time, which is every 4 hours, and then we have as the indication, which is as needed for pain, which is what we would use morphine sulfate for, which is morphine for pain. And so next what I'm going to do is I'm going to perform the second round of the 7 rights. So I'm going to do it with my syringe. So next we're going to do the right patient. So we have Jaguar J. Jones, date of birth 8/25/1963, and then 4176352 as a medical record number. And then we're going to just check the right medication. I have morphine sulfate. I do have morphine sulfate as my vial. And then we have the right dose, which is 5 milligrams. So I have 5 milligrams in my syringe. I'm making sure I'm checking with my order that I have 5 milliliters as my syringe. And then we have the right route, which is intramuscular, which I have my 3 milliliter syringe for that. And then we have the time, which is every 4 hours. And then we have the right indication, which is as needed for pain. And then right documentation, which is for all prescribed medicines. And so then I will go ahead and write down on my tape the drug name, the patient's name, Jaguar J. Jones, the medication name, which is morphine sulfate, and then the amount, which is 5 milligrams. I'm going to put this on my drug with making sure that I don't cover, my numbers. So I have the tape on here. And so next what I'm going to do is I'm going to go ahead and I'm going to perform hand hygiene again. And then I'm going to go ahead and I'm going to move to my patient. So I have my patient right here. And so I'm going to just tell Jaguar J. Jones, hey, we're going to do a something on you, and we're going to I'm going to give you your injection for your pain, which I'm going to use morphine sulfate. And yeah, I'm going to just do the 7 rights now. So I'm going to check his name, Jaguar J. Jones, and his date of birth, 8/25/1963, his medical record number 4176352. And so then I'm going to make sure that he, just told him what it was. And so I do say he's allergic to penicillin. So I'm going to ask him, are you allergic to any other allergies? And if so, I need to assess him and insist him on that. And so next what I'm going to do is I'm going to raise the side rails to a working area, and then I'm going to go ahead and I'm going to do that. And then I'm going to perform the rest of the 7 rights. So I'm checking again for the right medicine, which is morphine sulfate, which I do have morphine sulfate in my vial, and I do have it in my syringe. And I'm going to check for the right dose, which is 5 milligrams. I do have half a syringe, which is 5 milligrams in my syringe. And then I have the intramuscular, the 3 milliliter. And then we do have every 4 hours. So I'm taking it to him because he hasn't taken it in 4 hours. And then the indication, which is that he needs it for pain. And so now I'm going to do is I'm going to perform hand hygiene. I already did that, but I'm going to do it again. And so now I'm going to don on my gloves, and then I'm going to put on my goggles. And so now I'm going to do is I'm going to go ahead and I'm going to give him this injection. So since it is an intramuscular injection, I'm going to put it at a 90-degree angle. I'm going to pull out the skin. Before I do that, I'm going to use an alcohol rub to wipe down his skin. So we're going to wipe down the skin. Then I'm going to leave it kind of close to his site just to, kind of make sure that I know where I need to go ahead and do the injection. So since it is an intramuscular injection, I'm going to pull the skin, but what I'm going to do first is I'm going to pull out the top of the syringe, and then I'm going to roll that away in their waste container. And then I'm going to pull the skin. And since it's a intramuscular, I am going to do this at a 90-degree angle. So I'm going to do it straight down. And then I'm going to aspirate because it's an intramuscular. And then I'm going to push it down slowly. Okay, and now I'm going to throw that away in my waste container. And so now I'm going to just check. I'm going to wipe away again with the alcohol swab. I'm going to throw that away. And so then I'm going to just check to see if the patient's okay, if he's doing any fine. And so now I'm going to lower his side rails and lower him to no, I'm not. I'm going to lower down the bed, and then I'm going to lower the side rails into a comfortable position and just check to see if he's doing okay. And it seems like he's doing fine. So I'm going to go ahead and remove my sterile gloves and my goggles. And I'm going to just check to see if he's going to be okay within the next 30 minutes, if he has any allergic reactions or anything like that. And then I'm going to do documentation. So with documentation, I will document the 7 rights. So the right patient, which is Jaguar Jones, and his date of birth, which is 8/25/1963, and his medical record number 4176352. The right medication, morphine sulfate, the right dose, 5 milligrams, right route, intramuscular, the right time, which is every 4 hours, and then the right indication, which is pain, and that will be it. So I think I have finished my check off for administration medication. Thank you. Bye.